There are many health benefits after a person has a dramatic weight loss following bariatric surgery. But the skin doesn't melt away with the pounds. We spoke with Dr. Allan Wu, Assistant Medical Director at the Morrow Institute in Rancho Mirage, and asked him why would someone need abdominal reconstructive surgery after weight loss.
With bariatric patients in particular, they usually undergo a transformation of their abdomen wherein the overlying layer just above the musculature is extremely weak. This fascial area is kind of an Achilles heel or weak point of the abdomen, wherein a lot of patients will end up developing hernias or unsightly appearing contours on the abdomen afterwards. And it's precisely for that reason that many patients come in and ask for something equivalent to a tummy tuck or an abdominal reconstruction or hernia repair. And what we have recently published with our manuscript in the Aesthetic Surgery Journal is a paper that very carefully outlines the safest way to perform a post-gastric band abdominoplasty. In the past, many practitioners would simply do the abdominoplasty without really any caution or care to the band apparatus itself. There are some practitioners that would just simply pull down the skin and not care about what was happening deep inside the abdomen. What we found out is that some of these patients will develop intra-abdominal adhesions. And if you were to just simply pull the skin tight and do a standard abdominoplasty, you could potentially hurt that patient seriously to the point where they could have bleeding within the abdomen or require complete revision of their intestinal tract. And so we have taken the steps to determine what are the safest maneuvers in order to effect a normal appearing tummy tuck after a lap band procedure, and also to assure that the apparatus is still functional so that the patient may continue to gain benefit from their band.
We asked Dr. Wu to tell us what the main benefit is for a patient having this type of surgery.
The main benefit to the patient is A, they will not have any damage to their intra-abdominal structures, so their intestinal tract will not be hurt at all following this abdominoplasty. Secondly, they will still have access to the band. We keep the existing apparatus in place and we make sure that it is still functional. But the third and most important point is that afterwards, we reposition things in such a way so that the patient has a normal appearing contour. And so the patients can benefit from the procedure because they have continued use of their gastric band and they have a normal appearing and a normal contoured abdomen afterwards as well.
This type of procedure is performed at certified surgical centers like the Morrow Institute.
With the post-gastric band abdominoplasty, it is perfectly safe to have their surgery done here at the Morrow Institute. It is a AAAHC certified center that has been certified for over 20+ years. And it is the highest level of surgery center certification. We also have access to 7 other subspecialists, and we have an extensive history and comfort with working with these particular devices and surgeries.
How long does this surgery take, and does it have to be done again?
The operating time for the special abdominoplasty is no more than a standard abdominoplasty. It's just that we do particular maneuvers to the port and use special sutures to keep them in place so that the patient can have access to it at a later point in time. The effects in terms of the body contouring and the aesthetic effects on the skin will last a lifetime, so as long as the patient does not gain their weight again. When we do abdominal reconstruction here at the Morrow Institute, we look at every single defect that is there and we fix everything while it's there. And what's more important for patients to know and understand these days is that there are many legitimate medical problems that lead to surgeries like abdominal reconstructive surgery that end up with results that look like a tummy tuck but do provide and lend to a better and normal functioning abdomen. The other aspect of the Morrow Institute is that we do provide very high quality aesthetic cosmetic and plastic reconstructive surgery. Dr. Morrow in particular has a very well-trained eye for the human form and the best aesthetic result. And no single case is done without his very careful inspection So you can always rest assured that you have the highest level of care, cosmetic and aesthetic-wise.